Thanks for that warm introduction. It's very nice of you. And I appreciate the invitation to be here today. This is a really important topic and very near and dear to our hearts in APHIS. Unfortunately, I do have a conflict right after this, so I'm going to have to run right out. But I did want to make sure that I had a chance to come and give a few remarks to the group. So I appreciate your kind indulgence for letting me kind of talk about it. This is really quite a timely topic. Looking at the interdependency between animal and human health. It's hard to read the headlines these days and not get the message loud and clear that human health is directly affected by the health of animals. It's vital that we focus on how human health, animal health, and the environment are interconnected, because by improving the condition of one, we can improve the condition of all. As we all know, the continued growth of global travel and trade creates new pathways for the movement of agricultural pests and diseases. We're challenged by new and emerging pests and diseases, including an increasing number of animal diseases with zoonotic potential. Now more than ever, our own health is inextricably linked to agricultural health, and there are growing opportunities for diseases to travel from country to country and from continent to continent. Such realizations prompted animal and public health officials across the globe to create the One Health initiative, recognizing the interconnectedness of people, animals, and the environment. As you and I know, the concept of One Health is not new. APHIS, the veterinary community, and livestock and poultry industries have a rich history of applying veterinary public health principles to protect human health. But changes in the demographics of our human populations, along with changes in agricultural production, provide new challenges in disease control. During the past 3 decades, approximately 75% of emerging human infectious diseases have been diseases that can be transmitted between animals and people. The One Health approach is a landmark effort intended to pave the way for cooperation on public health and zoonotic diseases at federal, state, tribal, and local levels. As part of the One Health initiative, APHIS is working with other USDA agencies to facilitate greater coordination and collaboration on a broad range of agricultural issues and to better protect our agricultural systems. American farmers today are facing tough economic times as the world faces unprecedented global food insecurity. They also experience burdens associated with environmental and public health issues. It's vital that we apply the One Health holistic principles to these problems to provide balance, to ensure continued economic development of rural communities while conserving ecological resources, and to ensure a safe, plentiful, and wholesome food supply. The One Health initiative will also improve the global marketability of U.S. agricultural products and continue to support the U.S. trade surplus. APHIS is already collaborating with other federal agencies such as the Center for Disease Control and Prevention to identify science-based interventions along the animal production chain to ensure the safety of our food supply and protect public health. We will continue to refine and adapt our agricultural safeguarding system to address these increasingly complex challenges. This safeguarding system consists of a comprehensive, interlocking set of programs. Together, these programs work to protect health and marketability of U.S. livestock and crops from foreign pests and diseases. One Health principles include examining interdisciplinary collaborations in all aspects of human care for animals, humans, and the environment. They also include increasing capacity for human, domestic animal, and wildlife health surveillance, and for timely sharing of surveillance findings. And One Health principles include conducting strategic and collaborative research among human health, domestic animal health, and wildlife health entities. In support of these principles, we will continue in our avian and pandemic influenza efforts. USDA has always been a key player in pandemic influenza preparedness from the animal health perspective. Our One Health activities have developed from our involvement in zoonotic influenza issues at home and abroad. APHIS uses multi-pronged surveillance for highly pathogenic H1N1 avian influenza in populations of wild birds, commercial flocks, and live bird markets. In coordination with USDA's Agricultural Research Service, extensive research is also conducted on the complexities of this virus. In August 2008, CDC and APHIS entered into an interagency agreement to work to better understand influenza viruses and the increase in sporadic human infections with swine influenza viruses. As part of the agreement, CDC provided funding for APHIS to initiate a pilot surveillance project to monitor influenza virus in pigs and to study their transmission and pathogenesis. During the 2009 outbreak of novel H1N1 influenza, APHIS collaborated with CDC and ARS to make the H1N1 influenza virus available to manufacturers for the production of a swine vaccine by fall of 2009. This cooperative effort accelerated availability of the vaccine to swine producers. USDA is also a key partner in the North American Leaders Summit Health Security Working Group. We recently met with our counterparts from Mexico and Canada to discuss how we can work together to improve our collective response to pandemic influenza. Currently, we are rewriting the North American Plan for Avian and Pandemic Influenza to reflect what we learned from the 2009 H1N1 pandemic. The new version will cover all animal influenzas. To continue our international One Health collaborations, in April of this year, APHIS personnel attended the 2010 International Ministerial Conference on Animal and Pandemic Influenza in Hanoi, Vietnam. Discussions focused on the need for increased international collaboration to address human, animal, and environmental threats in the wake of the avian influenza and the 2009 H1N1 influenza pandemics. The declarations developed at the conference are based on a One Health global approach to disease threats. APHIS will use those declarations as guiding principles to follow for proposed follow-up actions to move toward a domestic and global One Health approach. The cornerstone of the One Health framework is a robust coordination between agriculture and public health officials and agencies. For maximum effectiveness, all of us must work together on the complex issues affecting human, agricultural, and environmental health. Domestically, there are at least 5 USDA agencies with interconnected roles in avian influenza, pandemic preparedness, and the One Health initiative. USDA Secretary Vilsack has created a One Health multi-agency coordination group at the policy level, co-chaired by the undersecretaries who oversee APHIS and the Food Safety Inspection Service. A technical operational joint working group has also been created. As we move forward, we will continue to work closely with other federal agencies such as the CDC, the Department of Health and Human Services, and the Food and Drug Administration. We'll also work with the Department of Interior, the Environmental Protection Agency, and others as needed to reduce any redundancy, improve efficiency, and respect each other's core mission while balancing all these priorities to improve animal and human health and maintain the productivity and marketability of agricultural products. Additionally, we've established an APHIS Veterinary Services One Health Coordination Office to guide the implementation of One Health across veterinary services, USDA, and interagency offices. Combating and controlling zoonotic infections effectively requires collaboration between both domestic and international animal and public health agencies. APHIS will continue to seek out and develop interagency partnerships to safeguard not only U.S. agriculture, but also human and environmental health where our expertise can be applied. Our agency's veterinary services program has developed a strategic vision known as the VS 2015 to guide changes that will better position it to meet U.S. animal health needs in the year 2015 and beyond that. Through the VS 2015 initiative, we are evolving VS to meet the changing needs and circumstances of the national animal health landscape. VS understands that the public health-animal health interface is critical to its future evolution and has made it a key focus of the 2015 initiative in addition to disease prevention, detection, early response, and expanded interstate and international certification services. Through the 2015 One Health Working Group, we will provide leadership for the animal health component of One Health, and as a dedicated One Health partner, will contribute toward improving the global health of people, animals, and ecosystems. VS is also currently reevaluating and re-envisioning our bovine tuberculosis, brucellosis, and animal traceability programs to align them with this 2015 vision as well. All of these have important implications for animal health and potentially for human health. As the national animal health landscape continues to change, our programs must evolve to meet the challenges of the 21st century. APHIS will continue its strong partnerships with state animal health officials, agricultural producers, and industry groups, as well as veterinary organizations. We will also continue to strengthen our relationships with the emergency management community at both the state and national levels. And we will strive to enhance collaboration with public health, wildlife, and environmental agencies and organizations. News reports often cover animal diseases once they're detected in the United States, but APHIS is constantly engaged in many behind-the-scenes efforts to prevent and prepare for foreign animal diseases that are not currently present. While our colleagues at the U.S. Department of Health and Human Services are working hard to prepare for the possibility of a pandemic, those of us on the animal health side have the tools to help prevent one. By controlling the disease in animals, we can effectively reduce risk to public health and reduce the potential financial costs of zoonotic diseases. Early detection is one of the keys to the successful eradication of foreign animal diseases. APHIS's foreign animal disease surveillance efforts include field investigations, disease-specific surveillance programs, and accurate and rapid laboratory diagnostics. APHIS conducts disease-specific surveillance for many foreign animal diseases, including avian influenza, exotic Newcastle disease, classical swine fever, bovine spongiform encephalopathy, and infectious salmon anemia. We also conduct surveillance as part of our domestic disease programs, such as those for brucellosis and bovine tuberculosis. Of course, surveillance itself wouldn't be effective without efficient and accurate pest identification and disease diagnostics. The U.S. has some of the most advanced, highest caliber animal disease diagnostic capabilities in the world. APHIS has the National Veterinary Services Laboratory in Ames, Iowa, and shares facilities with ARS and the Department of Homeland Security at Plum Island, New York. USDA's National Animal Health Laboratory Network, with 58 laboratories in 43 states, substantially expands both our surveillance capability and our search capacity. We have state-of-the-art diagnostics for diseases such as foot and mouth disease, the novel H1N1 influenza virus, classical swine fever, and highly pathogenic avian influenza. If and when an animal disease emergency occurs in the United States, APHIS is on the scene to respond. APHIS employees from around the country are deployed to ensure that disease prevention, control, and eradication actions are taken. So I hope it's obvious that through ongoing vigilant surveillance and everyday efforts to protect the nation's herds from significant diseases, USDA is constantly engaged in activities to safeguard the health and safety of the American people. I know all of you agree that it's important that we who are in the business of ensuring the health of the nation's livestock, the public, and the food supply continue to collaborate and closely coordinate our efforts to create a seamless protective barrier against the risk of zoonotic diseases. I'm confident that by working together, we can tackle any future challenges that we encounter. I wish you good luck in your conversation today, and again, very much appreciate the opportunity to be here.